Hello friends, hi, this is Dr. Theo Gill. I want to talk to you today about a condition called Obsessive Compulsive disorder. There's some famous people like Howard Hughes had this condition. He was a germaphobe and avoided basically society, became kind of a hermit. He may have had other obsessions also and compulsions, but that was an issue for him. So in this condition, the person has obsessions. These are, intrusive thoughts, repetitive thoughts that are annoying, and the person is not able to get them out of their head. They keep coming back, and they get really, upset about it. And then they engage in compulsions in order to try to mollify their anxiety. They may wash their hands excessively, tap a certain number of times, arrange objects in a certain way, or do other things that they link with their relief of their obsessions. The obsessions, some evolutionary psychologists think that OCD may have served a useful purpose, like individuals that were checking security matters probably had a higher chance of surviving. So there may be variants of OCD that promote survival, but in the disorder it becomes excessive. So what can be done? What do you do about it? There's therapy. It's called cognitive behavioral therapy, and basically the person, they are exposed to their fear or their phobia or their obsession, like being contaminated by germs, so they're exposed, and then their immediate impulse, of course, would be to go and wash their hands repeatedly, and that's prevented. When you prevent that, it desensitizes them, so they don't feel as compelled to engage in these rituals, and it has an eddying effect. It kind of goes back, and the obsessions lessen also gradually. So you can do CBT, you can provide medications, the SSRI medications, things like Zoloft, Prozac, Lexapro. They all do work, but you have to use higher doses than normal, what you would use for depression. Like for example, for depression, you may use 20 to 40 milligrams of Prozac, and that would suffice, usually achieve a good response, and in about 4 weeks. But with the OCD, you have to go higher, 60, 80 milligrams of Prozac, for example, for a period of 8 to 12 weeks. And before you judge that medication has not worked, because the response may come late in the 10th week or something. So it's, you have to persevere with that. So all of the SSRIs do work. There's maybe a role for atypical antipsychotics sometimes, although there's some things in the literature that suggest that antipsychotics may exacerbate things sometimes. There's also mentioned that stimulants in low doses may be helpful with OCD. Some of the treatments, like anafranil, is another tricyclic antidepressant, which does have a stimulant component and a serotonin component. And that seems to be a little bit more effective than SSRIs by some meta-analysis of multiple studies. So, you have to treat them adequately at that supratherapeutic doses for 8 to 12 weeks, and you can see a response. You can train them to deal with the life obstacles that come in their way. They can hire assistants. They can do some work as self-employed individuals. That gives them more latitude in terms of being timely and so forth. As long as they get their job done, their business running, they can hire assistants to help. So, so you have the cognitive behavioral therapy, you have the medications. If these don't work, then there's surgery available also, and there's it's called anterior cingulotomy, and it's done surgically by lasers. Anterior cingulum is in the frontal forebrain, and it's basically transected, and it does help. It relieves OCD symptoms. The transcranial magnetic therapy may also be helpful. There's deep brain stimulation that can also be used. Vagus nerve stimulation has also been utilized. So with all these options, you can bring about a relief. You have to be patient though, because it takes a while to work through the side effects. It's stressful for them to work in CBT with their being prevented from engaging in compulsions. So it is tough psychologically, and then you have to monitor their meds and make them as side effect free as possible. And it is possible to do that. The relief is very obvious on their face, and they're grateful when you're able to help them. And it's a worthwhile endeavor. Once they're on it, you have to keep them on it, because it's a lifelong disorder. It doesn't go away like a common cold, but it can be managed. There's some thought that people with OCD may have higher intelligence, and I've seen people like that. Certainly, it didn't hurt their success. And Nikola Tesla was another person that had OCD traits. He had to have things arranged in a certain way. He had a ritual of walking around a building where he stayed a number of times before he went in. But he had a photographic memory, and he had very great visual-spatial memory, and so that was a gift that he had. But when you combine a lot of studies, it's hard to tease out like a generic answer to the question of intelligence and OCD. There may be a little bit of a higher risk with the highly intelligent individuals and OCD, and having OCD symptoms at least. It usually promotes their success, but sometimes when it becomes excessive, then it obviously is dysfunctional and is distressful, and distress is a disease. But they can be helped. So it's important to know. It's important to let your guard down and let your doctor really know, because he understands. He has heard about OCD. Your symptoms, no matter how bizarre they seem to you, will not be strange to him, because he's heard it. And ideally, a psychiatrist should be the one treating OCD, because it's not an easy illness to necessarily get your hands around. And family practitioners may not have the patience of the time, or the psychotherapeutic skills that go along with the treatment. Of course, they can delegate it to a psychologist, but I think it's better handled by a psychiatrist. It's a fascinating illness. I don't think I mentioned, but certain bacterial infections in children can precipitate OCD in them. It used to be called PANDAS, pediatric autoimmune syndrome. But it can occur in children, and the treatment is sometimes you can do a plasmapheresis that can help, because it's very distressful, and it's actually new, and for that reason it's distressful to the child and the family. So they're really eager to get symptoms under control. You prevent further strep throat infections, and standard treatment SSRIs can help those cases as well, or childhood OCDs precipitated by a bacterial strep throat infection. Pathology is complex, and the manifestations are complex. In fact, it has in DSM-5 has become a category of its own. OCD and the other disorders such as hoarding, skin picking, trichotillomania, which is hair pulling. So all these other compulsive disorders, there's a body dysmorphic disorder. They all seem to have the same neuropsychiatric pathology. There are differences in OCD compared to anxiety states. So it's a unique illness of its own. It deserves a lot of respect because it takes effort and focus and dedication to overcome it. But it can be overcome. Things can get better. Your symptoms can be relieved, made less, and even making them 20%, 30% less is a significant relief sometimes. So, that's OCD. I hope you gained some useful tips from there. Take care. Thank you. Bye.